Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the National Institutes of Health, roughly 28,000 kidney transplants are performed every year in the United States. Joining us to talk about organ donation for a failing kidney is Dr. Jenny Lamb, a transplant surgeon with the Scripps Clinic Medical Group in La Jolla, California. Doctor, thanks so much for being with us.
Thank you for having me.
So, what causes the kidney to fail?
There are multiple causes of kidney failure. The most common causes being diabetes and high blood pressure, but also other congenital diseases such as polycystic kidney disease. Polycystic kidney disease is where the kidney tissue is replaced by multiple cysts and no longer allows the kidney to function appropriately. This is a normal sized kidney. And so when people have polycystic kidney disease, the normal tissue is replaced by cysts and the kidneys can grow to be quite large.
So, then how do you know that it's time for you to get a new kidney, that you need a kidney transplant?
Patients that are on dialysis can undergo kidney transplant to attempt to stop getting dialysis. You can actually also get a kidney transplant before you are needing dialysis. So you can be evaluated by your nephrologist and referred to a transplant center before dialysis starts.
So, talk about living organ donation as opposed to getting a kidney from someone who has recently passed away.
So people that have a living donor kidney transplant tend to have better outcomes in terms of how long the kidney lasts for. And also, people that have a living donor kidney donation don't have to wait as long for a kidney transplant.
And what's the success rate of a new kidney from a living donor?
The success rate is really good, so about 98% in 1 year.
Wow. Okay, that's impressive. And you say the wait time for a new kidney from a living donor is a lot less. What's the difference in the wait time between a living donor and a kidney that's been donated from someone who has recently passed away?
So the wait time for a living donor kidney donation just really depends on how long it takes to undergo the evaluation process. But as soon as you have an approved living donor, then you can have your surgery scheduled. If you're waiting for a deceased donor kidney, that can take several years on the wait list. The average wait time is about 5 years.
We're born with two kidneys, but the organ donation is just one kidney. So, how does that work?
For healthy people, only need to have one kidney to do the functions that I had mentioned earlier. And for patients that are healthy enough to undergo living donation, those people tend to do just fine with one kidney.
And doctors will leave both kidneys in your body and then add the new kidney. So you'll actually have three kidneys in your body.
We tend to leave the native kidneys where they're at because they tend to not be causing any harm, even though they're not working. And trying to remove them can cause some additional harm like bleeding and things like that, injury to surrounding areas. So we tend to put the kidney in a different place that's in your lower abdomen, and then we connect the kidney here to the blood vessels that go down to your leg. So we connect the artery and the vein to blood vessels in your going down to your leg, and then we connect the ureter to the bladder, which is very close to the area where we're placing the kidney.
And if it's a living donor, both surgeries are actually happening side by side?
Yes, so on the day of surgery, we coordinate both operations very closely. We start with the donor surgery first, and once the kidney is getting close to being able to be removed, we start with the recipient surgery next door. And we try to time it perfectly where we can take out the kidney and give it to the recipient.
And the person who's donating the kidney, they can live a long, healthy life with just one kidney.
People that undergo living donation um, have comparable life expectancies to the general population, and also in terms of developing kidney disease. Sometimes it's actually a little bit lower risk for them because they're so hyper selected as healthy people that can undergo donation without any long-term adverse risk.
And so, how long are you in the hospital for the person who is getting the new kidney and also for the person who is donating the kidney?
The person that's receiving the kidney, they are generally in the hospital for about 2 to 3 days. And then for the person donating their kidney, they stay in the hospital for about 1 to 2 days.
So, what's the recovery time until you can get back to your normal activities for both the recipient and the donor?
So for both the recipient and the donor, people can be up and walking, up to a few hours after the surgery. And in terms of when they can get back to their normal activities, for the donor surgery, it is quite quickly because it is a minimally invasive surgery that they have. So they can be up walking, leave the hospital potentially the next day or the next 2 days. In terms of when they can go back to work, it's usually about 2 weeks or so, just depending on how they do. And then in terms of getting back to regular exercise, about 4 to 6 weeks.
And what is the life expectancy after you've had a kidney transplant, after you've been given this new kidney?
Life expectancy after having a kidney transplant is variable, but overall, people are able to extend their life to about 10 to 15 years, if not more. But it just depends on their particular situation.
What kind of medication do you need to take to make sure that your body does not reject the new donated kidney? And how long do you need to take that medication?
After you have the kidney transplant, you do need to be on immunosuppressive medications, which do exactly as they say. They suppress your immune system so that your body does not reject the kidney. Initially, when you first have the transplant, you're given higher doses of immunosuppressive medications and potentially multiple medications. But as time goes on, you can decrease the amount of immunosuppression that you're on, and some people can transition to maybe one medication or two medications.
And you'll take that there for the rest of your life.
Yes.
How do you know if you're a match for a living kidney donation, both for the donor and the recipient? What kind of tests do you undergo?
We do multiple blood tests and imaging tests for our donors and our recipients. For the donor to make sure that they're healthy enough to donate, but specifically to see if the recipient and a donor are matches, we check the blood type, and we also do something called a cross match to make sure that they are a good match.
Are there some folks who would not be a good candidate to be a living donor?
There are some scenarios where we aren't able to do living donation. So for anybody that's under the age of 18, and in general, people that are of very advanced age and people that have multiple medical problems. But we have to evaluate each patient as they come up. And that's we do such a strenuous process just to protect anybody that is willing to donate.
And talk about the Scripps Center for Organ and Cell Transplantation. What goes on there?
Here we have an extensive team that works diligently to expedite the process of living donor kidney transplant. So we try to get these evaluations done, and once we're able to facilitate the kidney transplant, we monitor our patients very closely and we strive for optimal results because we all really care about our patients and want them to do well.
If you want to be an organ donor, what do you need to do?
So if you want to be an organ donor, you can go to our website and fill out an application, and we will schedule you an appointment to see our providers and start that evaluation process.
Any final thoughts, doctor?
My final thoughts are that I encourage you to consider living donor kidney donation. You can really help to extend somebody's life, improve their quality of life so that they don't need to have dialysis anymore and that they can get back to their normal lives and it won't hinder your life as well.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you so much for having me.
If you want more information on organ donation, if your kidney is failing, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.